right, so we have Nancy with us today. She is 6 months after a lower eyelid blepharoplasty and about 9 months after upper eyelid surgery. So we had done ptosis repair of the upper eyelids as well as an upper eyelid blepharoplasty. I just want to ask you kind of what made you consider eyelid surgery?
Well, all of a sudden, I guess we did the upper lids in August, right? I guess that January, all of a sudden I'm looking at myself and I felt like my my lids had just collapsed, and I was just very aware of it because I like to wear eye makeup, as I mentioned to you, and it wouldn't even show. Mm-hmm. And so I started talking to my regular ophthalmologist about it and not having any idea how much my vanity would cost. And he said, "Oh, absolutely." He said, "Yes, it's droopy." He said, "Your other lid is droopy too." Then I thought, so he gave me referrals and you were top of the list as far as I was concerned.
So like she mentioned, there was a component that was definitely blocking the vision. But we were able to do some additional kind of add-on procedures to help with her vanity, as she says, but to make her, to help with some of the extra skin and the fat. We did separate your two procedures.
Right.
We wanted her more awake for the upper eyelids.
Right.
We wanted to get that cooperation to get the eyelid, accurate in height and measurements and things like that. And then we did the lower eyelids after the uppers had healed.
I was all set to do it all together, and then Dr. Rajjoub said, "I can if you insist. I don't recommend it." And I thought, well, if your doctor doesn't recommend it, you don't do it.
Yeah, in certain cases we can do for what she needed, and especially with the ptosis, we wanted to separate the two procedures. So tell us a little bit about, nerves before the surgery.
Well, I was nervous because it's your eyesight, and every time you have a procedure, everyone always talks about the infection, and my response is always, well, you're going to wash your hands and I'm going to wash mine. I mean, there's only so much you can do, but right. I just have faith in it's going to be okay. I follow the directions, and I wash my hands. I mean, I'm generally hygienic. So.
And how did you feel after the surgery? How was your recovery? Anything different with the top eyelid surgery or the lower eyelid, or any thoughts?
No, I was surprised. I mean, the first one, I don't think I had anything particular to do. But with the lower lids, it was 2 days before Thanksgiving. And it was just my family, but nonetheless, and it was no secret to them that I was having it done. Mm-hmm. But still, I looked pretty beaten up, to say the least. You're all red and whatever. Right. But everyone was like, wow, you look really good. I mean, they were surprised at how I looked. So I wore dark glasses places, but right. A lot of times people didn't even respond.
Right.
Nobody was staring at me like, ooh, what happened to you? So.
Right. And how about, friends and how's that been afterwards?
No one's noticed.
Which is what we like. We like that it's nice and natural, and, they say, it's kind of looking refreshed.
And my daughter particularly was like, oh, she said, because she had a friend that, looked pretty bug-eyed afterwards because it was too tight. And my gynecologist was encouraged. I don't know that she's contacted you, but she said, oh, you look great. She said, she has one client where one eye was one way and one eye was the other way. And it was, pretty awful looking. So, yeah. I mean, something can always happen, but right. No.
But that's what we aim to achieve, kind of nice, natural, recovery process.
But I mean, I felt prepared for the stitches and, what have you. And the thing that really was totally amazing to me, aside from the vanity thing, is I always thought there was something wrong with my eyeglasses. And it was because my lids were lower. And, there was that sense of shadow. Mm-hmm. And there's no amount of eyeglass changing that was going to help that. And the other plus was when my husband, who had been really against it, he said, I like you the way you are. And we have a 23-year age difference. I'm 23 years older than he is.
Okay.
And that's lovely when your much younger husband still thinks you're,
of course,
beautiful. He said, I can see your blue eyes.
Your beautiful blue eyes.
Right. He has very dark brown eyes. And so, that was very nice that he kind of relaxed about the whole thing.
Yeah. Well, so Nancy is 81 years old, looking fabulous. And so, it's really nice to see someone of your age that's able to still enjoy, the results from surgery,
yes.
Able to recover well, able to tolerate the surgery. And that, eyelid surgery, we're very fortunate. It's a pretty well tolerated recovery process and surgical process.
But it's still, I always get worried as I get older older if I need to have something done, not just a choice that you can't because you have a heart problem or you have whatever.
Right.
And
Doing it at a time when you can still be
and
safe enough to have it.
last summer when I fell and broke this vertebra, I mean, that really set me back. I mean, I was like, that really made me feel old. So now, however, I'm going on another trip. We went to Paris in April, and we're going to Norway in August, and so yeah.
So time to enjoy it. Any advice you'd give anyone that's looking to do eyelid surgery? Thanks.
No, I think you need. And I was really worried, and I thought, I have to say, your professional photo, you're very austere looking.
Oh, gosh.
When you came out of your office the first time, you're just like, oh my gosh, she's just so personable and so.
Thank you.
You had your all white on and your dark black, your black glasses.
Right.
It's a very formal.
So I need a new headshot. I need a new
No,
photo.
it's very formal. And I mean, you certainly want your doctor to be very professional. You don't want someone who's just kind of showing up in their torn jeans and their whatever, but it's still.
Yeah. Okay. I'll take the advice here.
But no, you had a lot of good press. A lot of people said, you just went above and beyond and making sure your patients were comfortable and so on. Yeah, you're just very encouraging, and you don't say, well, you're too old to have this done.
No, that's I'm glad we got this taken care of for you.
Yeah, me too.
Right. Thank you for your time.
Well, thank you for allowing me to be a poster child for you. I appreciate it.